This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Carnosin injection is an essential medication for managing irregular heartbeat conditions. It is both effective and safe when used under medical supervision. Indications and uses. This injection is indicated for the management of arrhythmias, particularly paroxysmal supraventricular tachycardia and Wolff-Parkinson-White syndrome. It is also utilized in diagnosing various heart problems, especially during cardiac stress tests, by simulating physical exercise effects and improving blood flow to the heart. How it works. Carnosin works as an antiarrhythmic agent by regulating heart rate, blocking abnormal electrical signals, and normalizing the heartbeat. Directions for use. Carnosin is administered intravenously by a healthcare professional, ensuring that the correct dosage and frequency are determined based on the individual's age, body weight, and overall health condition. Possible side effects. Common side effects may include headache, dizziness, nausea, and a sensation of flushing or warmth. If any side effects become troublesome, consulting a doctor is recommended. Precautions and warnings. It is vital to consult a healthcare provider before using this medication if you are pregnant, breastfeeding, or have any history of heart problems, lung conditions, or allergies to adenosine. FAQs. 1. What is Carnosin used for? It is used to manage arrhythmias and diagnose certain heart problems. 2. How does Carnosin work? It regulates heart rate by blocking abnormal electrical signals. 3. Can Carnosin cause low blood pressure? Yes, it may lead to hypotension in some individuals. 4. What foods should be avoided? Caffeine and xanthine-containing foods should be avoided for 12 hours before treatment. 5. Is Carnosin safe for patients with asthma? It is not recommended for those with severe lung diseases. Thank you for watching. If you have any questions or suggestions, please leave a comment below.